Thank you so much for Chanel to Chanel for coming through this morning. Now joining us on the line, Gail has reconnected with us, thankfully, from Johannesburg. A very good morning, Gail.
Good morning. Can you hear me now?
I can hear you now. Thank you so much for connecting again. What's your question or your comment for the doctor?
Okay. My mom had Paget's disease, and one of the things we learned later is that an offshoot of having Paget's is to have leukemia. And then she contracted myeloid leukemia and actually died from the diagnosis to the end within 6 weeks. That's all she lived for. And I want to know, how do we as a family check that we have it? Is it because she had the Paget's, which is what the doctors told us at the time, or is it hereditary, or was it just out of the blue with no reason at all?
Very good question. Thank you, Gail. Please stay on the line. Is it hereditary?
Yeah, so interesting. She mentioned Paget's disease, which is a disease that can affect bone, soft tissue, even be involved with breast cancer in this case. Interesting that one of the risk factors that predisposes you to developing leukemia is actually having received radiotherapy or chemotherapy for another cancer.
Wow.
So one of the known risk factors is actually having undergone chemo or radiotherapy for another cancer, which in this case certainly is applicable. Yes, there is certainly a very strong lineage of heredity when it comes to Paget's disease, as well as leukemia. But how she would start, where Gail needs to actually start, obviously, is if her mom had breast cancer from Paget's, she needs to be screened thoroughly for that. There is a gene that can be tested for when it comes to the cancers associated with Paget's disease. And with leukemia, it would be specifically having your full blood count, a simple full blood count to start the process, looking at your red cells, your white cells, and your platelet counts, and then to move forward from there.
How difficult is that? Excuse me, just butting in there. Do you
It's
just
a normal
draw
blood test. Yes, it takes 2 minutes, and that blood gets sent to you. And in that, they look at your full, what they call the full blood count. It looks at the amount of red cells, white cells, and platelets, and with the normal ranges. And then your doctor should explain to you, obviously, what those normal ranges are and where you fall in that process.
I just want to say to Gail, sorry for your loss. I mean, we listened to your story. Thank you so much for calling this morning.
Thank you.
Doctor, I can't help but harp on this. When should one see the doctor? I mean, what kind of symptoms are we looking at? I mean, it's like saying yesterday to a friend of mine, oh, I feel a little bit tired. And they're like, oh, you know, check for diabetes. So when does one check whether it's not okay?
And when it comes to diseases like this and cancer in general, the big signs for us as clinicians, when we're listening to your story, it's you know, quick change in your normal state of health. In other words, rapid loss of weight, an increased amount of infections. In other words, signs that your immune system has been compromised in some or other way. Easy bruising that you never had before, when you suddenly bump your head, your leg or your arm, and you'll see massive bleeds. In children, often the thing that triggers us as clinicians is nosebleeds. Children with recurrent nosebleeds, although, you know, children pick their noses. In summer, it's hot. They often have nosebleeds, but don't just write it off and think, it's hot, or they're picking their nose. Recurrent nosebleeds, you deserve to go and look. The child deserves that you go and look at their clotting profile, their platelet count, and to make sure that all the amounts of cells are in proportion and correct.
Okay, Dr. Darren Green in our studio this morning. Have you been affected by cancer? We're talking leukemia this morning. This is your Feel Good Breakfast Show. Give us a call, 083 9133728. We'll be back after the break.